Hi, everyone, and welcome back to the Dear Asian Community podcast. Today, I'm here with Linda Chan. Thank you so much for being with us today. So could you just provide, a brief introduction about what you do in your field and where you studied?
Yeah, hi everyone. My name is Linda. I went to a medical magnet high school in LA. I went to University of Pennsylvania for college and studied nursing there. So I got my bachelor's of science in nursing and a minor in healthcare management at Penn. Now I currently work as a clinical nurse too, or a registered nurse in Los Angeles in a surgical and transplant ICU.
Very cool. What inspired you to pursue medicine? Like, what was your journey of discovering what you wanted to do?
So I don't think I was necessarily pressured by my Asian parents to be a part of the medical community, but I was actually interested in pursuing medicine and was actually hoping to become a pediatrician growing up because I grew up as a caregiver for my grandmother who was like 80, 90 years old when I was a kid, and also for my brother who had special needs. So I've always taken on that role of caring for others, going to health clinics, interpreting for my family because they don't speak English. So I've had a lot of interactions with doctors and nurses, and because of my brother being my age, going to the pediatrician pretty often at the children's hospital. So I thought I wanted to do something very similar, and I've always thought kids were cute. So I wanted to head in towards that direction. Unfortunately, I am not near kids. I work with adults now, but that kind of like stimulated my interest in medicine and tried pursuing it in college.
For sure. Yeah. What do you specifically do like as a nurse? So I've noticed that a lot of people who pursue medicine talk about, caregiving and like working with patients. So is that a lot of what you do when you're at work?
Yes, for sure. The basic task of a nurse is to provide them with medications, give them the medications, educate the patient as well as the family on the medications and the conditions that they currently have. Although, if they do not speak English, we have like certified interpreters that we use to kind of communicate with them so that they are aware of what's going on and they're up to date with the goals of the cares that we're trying to provide for them as well as what their progress in their health is currently at. And in addition to that, a lot of the times our patients who are in the hospital who have to require to live in the hospital kind of are on a very weakened state. Whether it could be, not being able to stand on their own, get up on their own, or use the bathroom on their own. That's something that we also help them with. And working in the ICU, a lot of my patients at the moment, they're there for waiting for a liver transplant or they're there after a liver transplant. So most of our patients are very, very sick in the sense that they have very, very low blood pressures, require medications through IVs to keep their blood pressure up. So a lot of the medications that they have are through an IV. So inserting IVs is another role that nurses have. We titrate meds in the ICU, which means that we're basically adjusting the medications based on the current moments. So, like I was mentioned about their blood pressure medications, though we can change that on their IV pumps every 5 to 10 minutes based off of their actual blood pressures. We have specific lines that kind of give you like real time blood pressures, not just the ones that we measure with our cuffs that we usually get at our like annual physicals. We titrate medications, we give them medications. My patients basically cannot move on their own. A lot of them are not able to, whether lifting their hands are very weakened. So we mobilize them. So we have different machines that lift them up off their bed and then we put them on a chair and have them sit there for a couple of hours. We have little machines that kind of work as like stationary bike and we help them bike while in bed. If they're unable to do any of those stuff, we use exercise them with range of motion. So we go through a different range of motions to make sure that their joints are not getting stiffened. So that's something that we do. In addition to that, just like sometimes just chatting with them, providing that emotional support for them and their families while they're in the hospital. Reorienting patients is another big thing that we do. I don't know if it's ever happened to you. Imagine like just staying in a room like for nonstop every single day for like weeks on, and you're not in your usual comfort zone. You're kind of like dependent on the needs and the help of others. So what we have to do, a lot of our patients, they kind of lose track of time. They can't sleep at night because we do our assessments, our full body assessments almost every 4 hours. So their sleep is getting interrupted every couple of hours. So helping them realize, reminding them, today is this date. We are doing this today. You are currently at the hospital. And I know it's going to be tough, but we want you to be able to do as much as you can, and we will help you with whatever you need us to help you with. We do a lot of emotional support and the physical support as a nurse.
Mhm. Wow, that sounds like a lot, but very important job. Yeah, so I know that you talked that you specifically work as, a liver transplant nurse. I was interested to find out that there's like specific branches of being a nurse. So are they that different, or have you worked in different fields, or could you talk a little bit about that?
Yeah, of course. So during my nursing school, we actually go through different rotations. So I've been through rotations where I've worked in labor and delivery. I got to actually help with a woman giving birth.
Yeah.
Um, I've also participated in like community health. I've been in the emergency room. I've worked as a med surge floor nurse. And what I meant by med surge floor nurse is like it's medical surgical patients, but they're not sick enough to be in an ICU. It's more like a little transition period where they still need a lot of help. They still need to be monitored before they go home. I've also worked in the ICU, and my last rotation was in the ICU and working with, it was in surgical ICU. I was working with liver transplant patients as well at my school. So that's kind of like it piqued my interest there that I wanted to work in the ICU and with population that I'm kind of familiar with through nursing school. So that's how I applied to my current position. But there are various roles. I'm sure, when you go to a doctor, sometimes you might have to go to a specialty doctor, such as like going to a cardiologist if your heart's not doing well. If, you're having ear problems, you might go into like an ENT doctor. Like just like how like if our teeth is aching, sometimes our doctor will like send us a referral to a dentist, or if you need prescription glasses during your first physical in a while, they're going to tell you to go to an optometrist. So nursing kind of is very similar in that sense where there are different specialties. Whether you're working at a regular clinic, so there's outpatient and inpatient. Inpatient means working in a hospital. And there's also outpatient where you're just working at a clinic where you're pretty much kind of like stuck to like a 9 to 5 job, regular working hours. Whereas for me, I work in a hospital and I work 3 days a week for 12 hours each time. And there's night shifts and there's also day shifts. So for my hospital, our night shift starts at 7 p.m. and we finish our job at 7:30 a.m. And day shift would work from 7 a.m. until 7:30 p.m. During that 7 to 7:30 overlap, we are giving a report to one another to update each other on what's going on with our patients. And that's pretty much very similar to most hospitals inpatient, where that's kind of like the schedule, the 12-hour shifts. There are some that only work 8 hours. But aside from the difference between inpatient and outpatient, there's the different specialties. So you can work in aesthetics if you're interested in like giving Botox and all of that. That's something that a nurse can do as well. There are nurses who work at clinics where they can just start IVs in preparation for outpatient or like outside like surgery, like small surgeries or procedures. There are nurses like our regular family doctor offices. So those are the nurses who kind of help us with our blood pressures, people who give us our shots and draw our bloods. There are different types of role. There are different specialties. Like I mentioned that I'm in a liver transplant and like a surgery team. There are nurses who work in cardiology specifically. So they focus mainly on hearts. Sure enough, a lot of our patients have problems ranging from like their hearts to their kidneys and like, mobility as well. But a lot of the problems that they're admitted to the hospital for, that's what we focus on. If you have like a neurological problem, such as like, getting a stroke, or you were in a trauma accident and required to be in the ICU, there's a different IC for that. And these nurses know more specifically the equipment that needs to be done, the values that need to be done, or like to monitor based off of these specific conditions where I'm not so familiar with. So we have like, nurses available that are more experienced in these fields, kind of like, remind you on certain things that you need to watch out for. Although
Mhm.
we were all prepped in knowledge through nursing school, there are times when you just kind of like forget, just like how I kind of forgot all my calculus now. So it's like a constant learning process within the hospital system where you're just learning about different health problems and trying to understand what are it's necessary to treat. And I can also mention that, like, aside from working in a hospital, bedside nursing, nurses can also go into research. They can also go into management. They can go into education as well too. So there are different roles that nurses can head towards other than working with patients.
Yeah, for sure. I think it's very encouraging to know that there's different aspects of being a nurse. Since as I was growing up, I always felt like nursing was just a big, broad, like one profession. But as like a teenager now, trying to figure out, what I want to do in the future, it's really cool to see that there's like different things that you might be more suitable to doing. So I guess speaking of being teenagers. Was there any struggles that you had, in high school or when you were in nursing school that you would like to mention or talk about?
I think in terms of struggles, I was very focused on academics and kind of like neglected the fun part of, like, going through your teenage years, experiencing that, hang out with friends and a lot of that. I just hope that a lot of the kids, aside from focusing on academics, that they are able to enjoy their lives too. And that's kind of one thing that I focus on in college as well. I started off going into college as a biology major, thinking that I wanted to be pre-med because, like I mentioned, I thought I wanted to be a pediatrician.
Mhm,
But I realized it probably was not the perfect pathway for me in the sense that pre-med was very, very competitive. Some of the people were not as nice as I expected them to be, like some schools, pre-med students can be very toxic.
mhm.
And that was not the environment that I wanted to be in right off the start of college and realizing that's going to be the situation for all 4 years of college. So I was like, I don't think I would enjoy my college experience. I want that to be something that I am reminded of.
Mhm,
Nursing school was very collaborative. I recognized that I am a very visual person as well as a very hands-on learner. And that's something that nursing school offered to me, where I was able to go to clinicals.
mhm,
Sure enough, they're almost like working shifts throughout the week during your school year. So my schedule was a bit difficult. I think, like, if you're someone who's interested in pursuing nursing or in college in general, or somewhere where you have to kind of like have really good grades to pursue like a higher degree and then to go into more specific field, time management is something that you really need to work on.
mhm.
That way you can, sure enough, focus on your academics, get the grades that you want, but also be able to spend some time with your friends and enjoy that college experience. Because for me, I had to do two 12-hour shifts or like sometimes like 6 to 8 hour shifts in addition to the classes that I had. Nursing classes were very specific in that if you're late to your clinicals, you get fined or you have to skip the class. If you're late like 5 minutes, sometimes your instructors will be like, sorry, we're moving on without you. You're going to have to make up this entire class and you're going to have to pay a fine too. So that's
Oh
something that, like,
my
yeah,
God.
while nursing school, I'm telling you that I loved it so much because everyone's so nice. We were all helping each other study for our exams because it was such a collaborative part of our curriculum. It was not curved. Our grades were not based off of other people. It was whatever grade you got, this is what you're going to have. But I think my biggest struggle was the fear of failing or getting a C and below for a class because a lot of nursing schools, their cohorts are very small. Our cohort was only about 100 students in my school specifically. A lot of our classes, we only took it once a year. And if you failed it, you're going to have to wait until next year to take that class. And it also means that, all of our classes are based off of the previous class. Unless you pass this class, you're not allowed to go to the next level. So it puts you back a bit. So that's something that, like, I want people to remember. To focus on their academics, but not stress too much about it. In general, not being afraid to ask for help either. A lot of our schools offer tutoring. There are some schools that offer tutoring by other students, people who have taken the class and gotten a good grade. So those are people who you can probably feel less intimidated by because, it's not a professor recognizing, oh, you're dumb. But it's like people who probably understand how difficult this course is and have gone through the same struggles as you. So it's very helpful to not be afraid to ask for help when you need it because you don't want to, stress yourself out and feeling that you're incompetent when you very much are and you just need a little boost of help.
Yeah, for sure. As someone who has grown up really liking science, I'm taking a lot of pretty advanced classes related to science in high school, and I think like you and a lot of the people watching can relate. It can be really stressful, and so I think it was good to hear from your firsthand perspective. That is actually all the time that we have today, but it was very inspiring to hear all your advice, and I'm glad you could join us today.
All right, thank you so much for listening.